end of a treatment, this is where you need to do a few things one after the other. So just as a recap, say I finished the treatment, I've instructed the client how to dress back, and I would say, okay, thank you very much, the treatment is finished. By the way, it's not very self-explanatory. How do you actually finish your massage itself? So does any of you have anything, any like routine that you're doing at the end of, yeah, Heather?
At the end of my massages, I always tell my client that, you know, we're finished, and I always keep a fresh jug of water and a glass in the room on a table, and I just tell them I'm going to leave the room to give you some privacy.
But how do you tell them?
If she's lying on the table, I just lean down and kind of tell her quietly, so I'm not like at
shouting
her, because she's relaxed, and I say there's a jug of water and a fresh glass, help yourself if you're thirsty.
Good. So you can say that, you can say thank you very much, the treatment finished, take a minute, and then you can slowly come and dress and come and sit down. Or anything that instruct them what to do, rather than sometimes there are some people to say thanks, then they're leaving, client is still sleepy, dozy, though they don't understand that the treatment actually finished. So once you do that, you instruct them, you see that they're awake, and then you step out of the room, you're coming back to the room, and then from there it would be something like that. You say, so how do you feel? How do you feel? Yeah, good. What I felt, first of all, because I worked deeper, you might have some tenderness for the next day or two. It's normal to have that after I've been work on the muscles. If you have that, you can do the stretches I'm going to give you. It's quite normal to have it for about 2 days. After 2 days, it should go away. Yeah. What I felt is during the treatment that yes, there was some tension on the area that we've talked. I would say that most likely is related to the issues that we've talked through the treatment, like work or whatever. And however, the other area felt fine. I'm happy to say that I felt that you relaxed into it, and you know, your body really absorbed it. So I didn't find any major trouble. However, I would suggest if you can come once in a while and we can decide on how long in between the treatment, that would be good for you. What I would like to do to finish it, to give you a very simple, don't think it as an exercise, it's a stretch. You know, once you're feeling that your shoulders are a bit more hunched forward, you can do it really on the chair at work. Yeah, if you want to do that with me, you can just take and lean backward, yeah, and then take your hands this way, and really just feeling that you're leaning, but actually kind of balance it with your neck. So your neck not bending forward, but it's mostly your back. Yeah. And then you can do a small circles. And it should feel like in the middle back where the tension is, to have a bit of relief. You know, you can do it anytime that you feel tension there. Yeah?
Thank you.
Yeah, that's it. So it is quick. You can do something different. You can do the same feedback, and then as an advice you can say, okay, I would feel that if you take some advice on your posture, or maybe I can send you a link to a website that describe how to sit properly on it, that would be fine. But the aftercare should be quick, but do it seated. If you do it standing, kind of, oh sorry, but my next patient is here, they're not going to do it. So the most important thing, at the end of the treatment, ask them to sit, you sit down, and you do it professionally, yeah? Otherwise it's, yeah, he gave me the treatment and he was standing and looking at his watch, yeah? So give them that time. That's important, to stop the treatment on time, to give them that reflection time for them as well, yeah? If you want to ask them for feedback, you can. However, I want you to start giving them feedback as well, because I want you to get to understand that people would look up to you to say, so what did you find? Yeah, and I want you to communicate it in a nice way. Great. Question.